Hello, I'm Sonja Zweegman. I'm a hematologist working in the Amsterdam University Medical Center in Amsterdam, the Netherlands. And it's a pleasure to share with you the results of the HOVON 143 trial. The HOVON 143 trial is a trial using ixazomib, daratumumab, and low-dose dexamethasone in intermediate fit patients defined according to the IMWG frailty score. Well, you know that the Italian myeloma working group was the first to perform a study in intermediate fit patients, which was specifically designed for intermediate fit patients. And they investigated lenalidomide dexamethasone as a standard regimen and compared it with a dose-adjusted lenalidomide dexamethasone scheme, decreasing the dose of lenalidomide after 9 cycles of therapy to 10 milligrams, and then discontinuing the dexamethasone. What they found is that both arms gave approximately a PFS of 20 months. It was not head-to-head compared, but that compares unfavorable to the 26 months found with RD in the first trial, and especially also unfavorable when you compare it with the RD arm in the MAIA trial, giving rise to a median progression-free survival of 35 months. And that was mainly due to the discontinuation due to non-hematologic toxicity. And when you look to that, even the adjusted arm was better than the standard arm when you look to event-free survival, also incorporating discontinuation, heme toxicity grade 4, and non-heme toxicity grade 3 and 4. So there are 2 important findings for this study. In intermediate fit, the outcome is worse, and it cannot be compared to the whole population in other non-transplant eligible studies. And the inferior outcome is explained by especially non-heme toxicity. So we were the second to design a study specifically designed for intermediate fit patients. And we did try to improve the results by using a 3-drug regimen. And these were drugs known to have a very favorable side effect profile. So ixazomib, an oral proteasome inhibitor, and daratumumab, the monoclonal antibody against CD38. We decreased the dose of dexamethasone after 2 cycles already from 20 to 10 milligrams twice in a month, and after 9 cycles this was only given 10 milligrams every 8 weeks together with daratumumab. Now importantly, we found a very high overall response rate of 71%, and maybe even more important, that translated in an improvement in the quality of life of those patients. And the global health status, the role functioning, and also the future perspectives of those studies did not only increase statistically significantly, but even clinically significant. On the other hand, the median progression-free survival was limited with 17 months. And that appeared again due to non-heme toxicity. We observed non-heme toxicity in 59% of the patients, and there were mainly gastrointestinal, infectious diseases, but also neurotoxicity, so neuropathy. And so the non-heme toxicity partly explained the fact that only 50% of the patients did continue with maintenance therapy after 9 cycles of ixa-dara-dex with ixa-dara only. Also, 11% of the patients had to discontinue ixazomib because of low-grade neuropathy. And that indicates that this very vulnerable population might value independency in life, moreover, getting a longer progression-free survival, and therefore discontinued therapy. So, an important study to show that a 3-drug regimen is feasible, but gives rise to more non-heme toxicity. So there's an unmet need for further improvements. So how can we reach that? Now, what we showed that the monoclonal antibody daratumumab was very feasible in the intermediate fit. And actually we showed that even in the frail population, it was very feasible. And we just published that in the Journal of Clinical Oncology, also with ixa-dara-dex. So it might be very interesting to investigate a combination of monoclonal antibodies together with the novel CELMoDs, because the novel CELMoDs are known to result in much less non-heme toxicity. The other interesting option would be to see whether the bispecific antibody therapy will be feasible in intermediate fit patients.